Hello, my name is Veronica Ajewale. I'm an associate professor of pharmacy practice and the director for the Community Engagement Core of the NIH-funded Center for Biomedical and Minority Health Research here at Texas Southern University. I want to say a big thank you to you and the community members for joining us for today's program. We are really excited that we will be sharing a lot of great information alongside the experts or speakers and panelists that will be leading us into this conversation. So please have your questions ready. We would have an opportunity to take your questions after today's presentations. So thank you again for joining us, and we look forward to our continued collaboration. Thank you.
Good afternoon, everyone. Thank you all for joining our monthly health education webinar. I am Akilah Adams, and I will be hosting today along with Ms. Monique Congoria. Again, I would like to thank you all for joining today. Today's topic will be on caring for the aging adults. Our focus is on healthy aging and Alzheimer's awareness. As most of you may or may not know, June is Alzheimer's Awareness Month, so we want to bring awareness to this health concern. We would like to acknowledge our Center for Biomedical and Health Research here at Texas Southern University. We are under the leadership of our Senior Associate Vice President of Research and Innovation, Dr. Esther Alloway, as well as our Professor of Pharmaceutics and Program Director of the PhD in Pharmaceutical Sciences, which is Dr. Shea. Our Community Engagement Core background, we really focus on serving through health education and outreach. We bring clinical research awareness to our communities that we serve. We partner with various faith-based organizations, community-based organizations, and it's also federally qualified health centers. A part of our health education and outreach is providing continuing education credit for certified community health workers in the state of Texas. We also provide cultural competency training as well as community engaged research training. And we further develop our program through consistently receiving feedback via surveys at each event. We have focus groups on particular health topics regarding different chronic diseases, and we also have community engagement studios. Our Community Engagement Core is consistent of the individuals that you see in the photo. We are led and directed by our founder, Dr. Veronica Ajewale Memwa. We have a host of a team who helps with different things regarding clinical research, community health worker training. We have a cultural competency training consultant. We have our community health workers, our outreach coordinators, and our program coordinator who also supports the Community Engagement Core. On May 2025, we launched our clinical research registry. Since May 2025, we have over 375 people who have showed interest by completing an interest form in our clinical research registry, and we have 200 people who have fully consented. This is a major milestone that we like to acknowledge and bring forth to our community, and if anyone is interested in signing up for the registry, you can scan the QR code or you can click the link in the chat. Congratulations to our Check, Monitor, and Control team. This is TSU's first clinical trial that has been registered in clinicaltrials.gov. If anyone is over the age of 55 or you know someone who is and may be interested in participating in the study, this is a project that will span over 24 months where we are asking participants to monitor their blood pressure at home using a blood pressure machine that will be provided to you through the study. You can find out more information about Check, Monitor, and Control with the link that's provided in the chat, or you can scan a QR code right now. And today's topic, once again, will be focusing on Alzheimer's awareness, as June is Alzheimer's Awareness Month. We want to bring some education and spotlight to Alzheimer's awareness and provide some prevention strategies. If you are a community health worker that's certified in the state of Texas, by completing the webinar, you will be able to receive one continuing education credit. Thank you again for joining. We have more information in our chat. You can click the link. One, if you're interested in our clinical research registry, and the other link is to our link tree, which provides more information about all the programs we offer, as well as the opportunity to complete the survey and receive evaluation to receive continuing education credits for our community health workers. You can also stay connected with us on social media and subscribe to our mailing list. On all of our social media platforms, our name is CECTX Southern U. I would like to introduce our first panelist, Dr. Tyler. She has been an advocate for older adults and safe medication use throughout her career as a clinical pharmacist for over 25 years. She is a proud graduate of the Texas Southern University College of Pharmacy and Health Sciences, where she also serves as an associate professor of pharmacy practice. Dr. Tyler completed her pharmacy practice residency in Moorhead, Kentucky, and she is a board-certified geriatric pharmacist. She is also the co-principal investigator for the Check, Monitor, and Control Clinical Research Project. Dr. Tyler is a devoted advocate for safe medication use and improving health outcomes among older adults within our community. I would like to introduce Ms. Sade Akinfenwa. She is a registered nurse with more than 27 years of experience across a span of hospice care, mental health, surgical nursing, long-term care, and senior services. Both she and her husband co-founded a healthcare career school in 2008 that provides training to healthcare professionals in a variety of certifications, including nurse aid training, medication aid prep, EKG, phlebotomy, and CPR. In 2010, both she and her husband opened an assisted living facility where she focuses on supporting seniors, including those living with Alzheimer's disease. She is also a marriage and family therapist working toward full licensure in the state of Texas. I would like to introduce our moderator, Ms. Lena Bean. Ms. Bean is a proud graduate of the Texas Southern University. She has a bachelor's degree in sociology and a master's of education in counseling. She currently serves as the program director for TSU's Aging and Integrational Resources program. She has over 20 years of experience in human services focused on older adults. Ms. Bean has developed and implemented several health, education, wellness, and caregiver support programs across Harris County and the surrounding greater Houston-Galveston area counties. She has secured funding for evidence-based programs that includes chronic disease self-management, exercise initiatives, caregiver support, and she is committed to innovative community-centered programming for older adults. Again, these are our panelists and our moderators for today. I want to thank them for their participation. Now I ask them that they come off camera and unmute themselves.
Good afternoon. I think this is a wonderful topic, and caring for the aging is one of the things that I do, and I enjoy everything about the aging process. So I try to keep myself informed. Good to see some of our other panelists today, and have worked with Dr. Tyler before. I have a series of questions that I will be presenting to Dr. Tyler and Ms. Akafemawa, and we want to maintain the 2 to 3 minute responses to the questions because we have a lot to cover this afternoon. So my first question will go to Dr. Tyler. What are some of the steps older adults or caregivers can take to safely manage multiple medications at home?
Thank you so much for the introduction and for the question. So being a geriatric board certified pharmacist for over 25 years, my experience has been that a lot of times, well, first of all, as we age, we tend to have more medical conditions, more disease states, more things to manage medically. With that being said, we tend to have more medications that we have to manage. With that being said, sometimes that gets a little overwhelming. That can be complex, that can be challenging. And one might ask, what makes it so complex? What makes it so challenging? Well, some of the things is that just being educated on how to take the medication properly. What does that mean? Sometimes the medication, we have to take it with food. Sometimes we have to take some of them without food. And just being properly educated on when to take the medication. Is this something we need to take first thing in the morning upon rising? Or is it something we need to take at night before bedtime? Just so many variations. So just, I would say, patients and caregivers and anyone that's taking medications, especially multiple medications, need to be fully aware of how to properly take the medications. Just overall, just having an increase in awareness of the medications and their side effects. I mentioned side effects, not that that's a bad thing, but the more we know about side effects, the potential for a side effect. And a side effect doesn't always have to be so bad. It could be something, it could be sleepiness, which, you know, we need to be aware that the medication that we're taking may cause us to be sleepy. Therefore, we need to make sure we're timing that medication at the right time of day. So things like that, we do need to be aware of so that we can also communicate with our care providers, our pharmacists, our doctors. We can communicate with them if perhaps this medication, I'm just using sleepiness as an example, but perhaps it's making me too sleepy throughout the day. And so we need to, if we are aware that it could cause that, we can also have those conversations when those things happen. We can have those conversations with our care providers. And perhaps there's some alternative medications or therapies that we could use to prevent or to alleviate some of that.
Thank you, Dr. Tyler. And also, if you're taking those multiple medications, it's always good to kind of have a managed system in organizing those medications. You might have to write something down sometimes to remember when to take, how to take. But thank you so much for that response. Ms. Akafima, what should families look for when choosing an assisted living facility for someone with Alzheimer's or dementia?
Thank you so much, Ms. Bean, for that question. That's a very, very important question to consider when you are trying to place your loved one if they have dementia. The first thing to consider is what stage of the disease is that person in? Because if they are in their earlier stages, depending on the care that they need, they may be able to survive in an assisted living. But if they are in the late stage, the moderate to late stage, they might need to go to a lockdown facility because at that stage, they may be wandering and they may be experiencing what we call sundowning, whereby they have confusion in the evening time. So that will determine if they are going to an assisted living or to a nursing home with a lockdown unit. So once you determine that, the next thing to consider is where are you going to go visit? What kind of facilities? How many facilities? I suggest you visit at least 3 facilities. And I also suggest that you have 1 or 2 people with you when you are making this decision, because there are some things that you may not know that other people might be aware of. Also, I would suggest that you have some questions written down to ask about the facilities when you visit. And when you visit, make sure you look at the countenances of the patient that are there. Are they happy? Are they sad? Okay, that will tell you what is going on in the facility. Also, is it a clean facility? Do they have safety measures in place? Do they have handrails? Is it well lit? All these things you have to make sure that they have. Do they have enclosed courtyard, and what kind of trainings do their staff undergo? Because when you take care of dementia patients, you need to have a lot of training, at least 12 hours a year, so that you can be current and know how to safely take care of the resident. Also, you want to look at the ratio of the staff to the patient. You want to ask those questions. What are the ratios during the day? What are the ratios at night? so that you will know how many people, maybe 10 to 1 or 12 to 1. Okay. And then you want to see what kind of activities is available for your loved ones. Not to say that they're going to participate in activities, but you want to know, are they available if they need to? Because depending on the stage of the patient, they may not participate at all, but you want to make sure at least they're available. But most of the time, what I've detected in all my years of experience is music always do the game for the dementia clients. Everybody love music. They can listen to it. It calms them down. So all those things you want to look out for. And finally, you want to consider the cost. Okay, it's very, 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 expensive to take care of dementia clients. So you want to compare cost. You want to compare, nearness to your house, because you want to be able to get up and go see your loved ones whenever you want to, without considering, if it's a long distance or not. Okay, thank you so much.
Thank you. Thank you. That was some very good information. And the one thing I thought about as you were talking is this is the most difficult decision to make, to kind of let go and let someone else care for your loved one, because you always think that you can offer the best care there is. But we have to remember that we are not super women or super men, and we always need some assistance when it comes to caring for a loved one. So thank you so much for that response. Dr. Tyler, are there medications or supplements or health habits that support long-term brain health? And what should people be cautious about?
Okay, thank you for the question. So currently, there's no cure for the disease generally, but there are some medications out there that can slow down the progression of the disease state. And basically, you've seen the commercials. You have Aricept, you have Exelon, Namenda is out there. And those medications, they just slow down the progression. But thanks to all the research, we're doing a lot of more research. More medications are hopefully becoming more available on the market. But supplements can be used, but they don't have any the evidence is inconsistent on whether or not these supplements are helpful. They may be helpful, but they may not be helpful. The information is just not consistent. But what I do want to, as a pharmacist, what I do want to bring to everyone's attention is polypharmacy and drug-drug interactions. So if one does decide that they want to take the supplements to support brain health, which may be fine. I think magnesium is one of the supplements that's been promoted, but we also have to keep in mind about prescription medications that one may be taking, or the patient may be taking, and the potential for drug-drug interactions. So, it's a fine line there. And again, communication with the pharmacist, the local pharmacist, as well as with the healthcare provider will assist with that. Other non-pharmacological ways that we could use to support brain health include things like maybe brain activities, maybe puzzles, doing a puzzle, a crossword puzzle, bingo seems to be pretty popular. Those things can help with just keeping the mind active and keeping the mind active and motivated, supporting cognitive function in that area. Research also shows that just keeping up with cardiovascular risk factors, decreasing your cardiovascular risk factors. So exercise, we can't get away from that. Exercise could be very helpful in keeping the cognition up and going. Lifelong learning, things like participating in the webinars and things like that, and other community engaged activities can help with cognitive function and things of that nature. I think the fatty oil, the omega-3 supplements also is out there and available. But again, I want to caution the use of these medications simply because the evidence, the literature does not always support, it's inconsistent. And there's also the potential, if you're taking other medications, that there could be drug-drug interactions.
Oh, Dr. Tyler, thank you so much for that information. Very good information. I'm going to move now to Ms. Akafinawa. What steps can active adults, and this is a very good question, what steps can active adults take now to plan for future care needs while maintaining independence as long as possible?
That's the
Yes,
goal.
good one. Yeah.
That's the goal, to maintain independence as much as
Yes.
possible. And we don't want, none of us want anything, to, tamper with our independence. We want to hold on to it as much as we can. But what we do now, we actually determine the future. So the first thing I would say is eat well, take good care of yourself. Because what you do now, like I said, will show up in your later lives. Take care of your skin, your teeth, everything. Be a whole person, okay? Travel. I want you to travel, go on vacation so that you are not full of regrets, when you get older. So build a strength training routine, exercise. Dr. Tyler mentioned that, for your muscles and your joints, okay? Overall, cycling, swimming, whatever you find enjoyable, we have to include exercise in our daily routine. Also, we have to prioritize consistent saving or investing. I'm sure if we ask by count of numbers here, most of us don't have long-term care insurance. Out of all these 20-something years that I've been in nursing, that I've been in long-term care and having an assisted living, I think I can count on my fingers, maybe 2 or 3 people that came to us with a long-term care insurance. And if you must know, old age is expensive, especially if you have to go into an assisted living or long-term care facilities. And if you are if you are in your 20s or 30s here today, please take this home. Get yourself a long-term care facility because they will pay for your care. And if you don't do that, if you don't prepare for old age, you're not gonna like what you see. Okay, or you can maximize your 401k, your IRA, all of those things, and also I want you to maintain a preventive health screening. It's very, very important. Once or twice a year, go to your doctor, get your health screening done. Your doctor knows what you need, and don't let the doctor be your enemy. They are your friends, okay? And also, to prepare for old age, you need to probably have an advance directive, a living will, so that you can appoint people, in case something happens, can you make decision on my behalf? Or this is what I want a CPR, cardiovascular, cardiopulmonary resuscitation. This is what I need, this is what I want. You can make those decisions in advance before you lose your independence. And also have a community, because loneliness can take you there to lose your independence quickly. So have a community, a church community, your friends, your family. Always get out of the house, and mingle with other people. And of course, I cannot stress enough the value of sleep, the value of hydration. Water is very, very essential. You need at least 2,000 ml of water every day to drink, not soda, not iced tea, just pure water, because water is life, really. And you need at least 8 hours of sleep. And there is a study, I think, that correlates dementia with sleep as well. Also with diabetes. So if you are diabetic, watch yourself, take care of yourself. It's not a death sentence to have diabetes. Just comply with your doctor what you are supposed to eat, your food, your exercise, your diet, all of those. And Dr. Tyler already mentioned this, keep your mind active. Okay, puzzles, bingo, read a book. Okay, read a book, So all of these skills will help you to prevent cognitive decline. Thank you.
Thank you. Thank you so much for that response. And just like for children, when they're growing and they say it takes a village, well, it also takes a village as you're getting older. And
Yes.
that isolation can really bring you down if you don't have connections. I'm not saying just tell everybody your business, but you do need to have a close relationship with people that you can trust around you. Thank you so much for your response to that. Dr. Tyler, how can community health workers support medication adherence and identify red flags when working with older adults experiencing memory challenges?
Okay. Thank you for the question. So in general, community health workers, they basically connect people in healthcare services and provide support to improve general health care. So the question is, how can they help support medication adherence? I talked a little bit on my first question. I talked about how it can be overwhelming, just the instructions on the medications. Then we talked a little bit about polypharmacy, where polypharmacy is basically taking 5 or more medications in a day. That can be kind of complex, and that can limit or inhibit one's ability to take the medication as instructed. And what does that mean? Sometimes the medicine may be take once a day, sometimes 3 times a day, sometimes 4 times a day. That takes a lot of coordination. And if it's not coordinated properly, that can prevent one from taking it as they should. So community health workers can help provide access to community members on different services. Perhaps they provide information on how to better adhere. We know you have your pharmacist, you talk to your pharmacist, you may also talk to your healthcare provider, but the community health worker can provide additional resources such as pill boxes. They can provide information on access to obtaining pill boxes. They can provide additional education on the importance of adhering to your medication regimen. Because if we're not following the regimen, we're not perhaps going to get better with whatever we're trying to treat. So we're taking the medication for a reason, right? So we need to adhere to the regimen that's presented. They have the community health worker can provide resources to perhaps different apps that you can use on your phone. One app in particular that I've used in a previous research project called Pill Reminder All-in-One. And that app basically helps to help people to adhere to their medications. You use the app, you enter those medications into the app, and then you'll get an alarm when it's due to take that medication in an effort to improve and increase adherence to those medications. So community health workers can help be very accessible to the public, and they can also provide resources and early communication between the community participants, as well as maybe a pharmacist or the healthcare provider. They can they're out in the community, and they able to help to maybe solicit more information on what are some of the problems with why the community members aren't able to adhere to the regimen. And perhaps they can even come up with, or maybe bring in a pharmacist to communicate or provide more additional education, or maybe they can provide another healthcare provider to come in and give more information on how to better adhere to the medication regimen.
Yeah, wonderful, wonderful, wonderful response to that question. And as you think about those community health workers, are there to provide you, the caregiver, with information. And I always say that information is empowering to a caregiver, because it's if you don't know, you can't respond appropriately. So having a community health worker really provides that extra information for the caregiver. Thank you so much for that response. Ms. Akafina, what role can community health workers play in easing the transition into assisted living for both the patient and the family?
Yes, ma'am. That's a very good question. Thank you so much. So the community health workers, they are mostly the closest to the patient apart from their families. So they come in, they are able to see signs and, tell the family, this is what I'm noticing about your mom. This is what I'm noticing about your dad. So they are right there to give information to the patient, to the family, and then they in the hospital setting, in the long-term care setting, they are the case workers, they are the social workers, they are these people, they are the caregivers, they are the nurses. They notice things going on with the client, and then they relay to the appropriate resources for the patient, maybe to the doctor, whatever that the patient needs. So either they are living in their homes or they are living in the facility. These community health workers, they are the people that bridge the gap really between patient and families. So they can make recommendations depending on their areas of preferences. They can actually be the one to recommend or suggest facilities to the patient's family. They will be the one to consider cultural relevant information and be able to, give information to the family about whatever disease the family is going through, especially, the patient is going through, especially if it's dementia. They're able to provide information. They're able to tell them the kind of diet that the patient can be on and all of that. They just take care of the overall wellness of the patient. So they help the family to overcome barriers and connect them to healthcare services. If they need home health, they will be there. If they need public assistance program, they need food services, all of those things, and affordable housing. And these people, they tend to go everywhere, from facility to facility, from homes to homes. So they tend to know what is out there. So they are very, very resourceful. I have a guy, a man in our home right now that we take care of in our facility. He has some community health services with the mental health services that come. And then once a week they come, sometimes twice a week. They're able to take him out to, if he needs to go somewhere or go to the grocery, if he needs something special that he wants, and even take him to the pharmacy to pick up his medication. With that, it keeps him in the society. He has a sense of independence for himself, that he's still able to do this and that for himself. So community health workers are great resources that we need, and they are a bridging gap between the patient, the family, and the healthcare workers as a whole. Thank you.
Thank you. That's good information. And as you were responding to that question, I thought about the caregiver as well as the patient. We are always, as a caregiver, looking for someone we can trust,
Yes.
someone we can depend on, someone that gives us information that we could really use and beneficial to what we're going through at the time. So thank you so much for that response.
Yes.
Good afternoon, everybody. Thank you, Ms. Bean, for those great questions, and Dr. Tyler and Ms. Akina Fimwa for those wonderful responses. Really it was great information and additional resources for the community, especially for those older for the aging adults. I'm sorry. So I do have some additional questions. This one is going to go to Dr. Tyler. So, as one of the principal investigators for the Check Monitor Control Study, how do you bridge the gap between clinical data and actual community trust, especially when it comes to getting older adults to actively monitor their health?
Thank you for that question. So, what we found is that, okay, in general, as we age, we tend to have more chronic disease states, and as we get more conditions, it gets more complex when we add in medication. So with that project, what we decided to do, let's see how we know everybody goes to the pharmacy. We know people are picking up the medication from the pharmacist. We know the doctors are prescribing, but let's see how we can get in the community, actually use a community health worker to get into the community and support what the physician has given, the instructions the physician has provided, the information that the pharmacist has provided. We said, let's see if we can get a community health worker to get into the community and find out if there's additional support that they can provide. That support could be anywhere from helping to with medication management. That support could be anything from adding, maybe putting together workshops for nutrition, or putting together workshops for physical activity and things of that. But we thought that it would be very essential to see if, in addition to the pharmacists supporting our older adults with managing their blood pressure, how can we also incorporate let's see if we incorporate a community health worker in addition to the pharmacist for that additional support, to see if we have a better outcome. Better outcome just simply means better control of our blood pressure, a decrease in mortality. What does that mean? Decrease in strokes and decrease in other cardiovascular outcomes, negative outcomes that can happen when we don't manage and control our blood pressures.
Thank you, Dr. Tyler, for that great answer. And as you mentioned, as myself, I'm also a community health worker. So being foot on the ground and being out in the community and giving individuals and families that empowerment and help them, with their health outcomes and improving those. So thank you so much. I do have one more question. I'm going to turn it over to Ms. Bean. So I know you are our moderator today, but I'm going to turn the tables just a bit. So Ms. Bean, we know that stress of raising grandchildren can take a big toll on grandparents' own health and memory. So for any grandparents in our audience with responsibilities, how can your grandparents raising grandchildren program help ease that stress, and how can it help them keep their own minds and brains healthy as they age?
Thank you so much for that question. And I just kind of want to bring everybody up to date on grandparents raising grandchildren. Nationally, they have put grandparents raising grandchildren under the umbrella of caregiving. So the grandparents is also a part of caregiving done by a family member. So the first thing that we do in working with grandparents raising grandchildren is identify who they are and that they recognize that they are caregivers as a grandparent raising grandchildren. And along with that comes a multitude of issues that they have to deal with. And one is legal. So we deal with that through our Aging Mastery program. We invite our grandparents over to campus to participate in what we call the Aging Mastery program that covers several areas. Number one, navigating long life, because you don't know how long you're going to be here, but you need to be prepared for it. So we introduce them to several areas. One being exercise. And I know that with a grandparent raising grandchildren, sometimes you feel isolated and you don't want to do certain things because you feel like you have this added responsibility. But we encourage our grandparents to get out there, go walking, start gardening, pick up a hobby. Journal is the other thing that we do. We have them to start journaling, writing it down. And then the other thing that we encourage them to do is don't be afraid or ashamed to ask for help. Again, it takes a village. And then the other thing we talk about is financial issues that grandparents have to go through. We also talk about housing, because now your housing situation has changed. You may live in an apartment and now you're caring for grandchildren. You may have had only one bedroom. Now you need two. So those are issues that you have to deal with. Your plans as far as your socialization with your own personal friends will change as well. But here at Texas Southern University, along with our Aging Mastery program, and we address all of the legal issues. We work with the Thurgood Marshall School of Law. We work with the College of Sociology so that we come up with ideas for them to do as far as community service is concerned. And then the other thing that we do is we provide a health and wellness program here on campus at TSU. And we call that Aging in Motion. So we get our grandparents to get involved in that program because it is focused on aging and healthy aging, meaning that if you have arthritis, we provide an arthritis exercise program. We provide arthritis aquatics programs. And now our newest addition to our summer program, of course, is our Tai Chi. And along with that, always bits of information that a grandparent can take with her and utilize that to help her to be a stronger, more powerful caregiver.
Thank you, Ms. Bean, for that. It looks like they're really busy and interacting when they come out with the, when they're associated with that program that you have, which is great. So thank you so much for that information. I do have a few questions. I think we have some time to take some questions here from the viewers. So give me 1 second. So we have one question. It says, I have read that metformin can help stabilize Alzheimer's. Is this true?
So
I'll refer to Dr. Tyler. Thank you.
Yes. So I'm not familiar with this, but again, better management of your whatever chronic disease state. So that should support, improved healthcare. But I'm not familiar with that. And that I mentioned before, there's a lot of information out there that is consistent and inconsistent on management. But at this time, there's no cure for Alzheimer's dementia, but there are medications that are marketed and FDA approved for to prolong the progression of it.
Thank you.
Slow down the progression.
Thank you. We do have another question. So given the prevalence of polypharmacy among older adults, could you discuss the best practices for identifying potentially inappropriate medications that may contribute to cognitive impairment or exacerbate the dementia-related symptoms? And then what criteria do you recommend when considering prescribing in patients with dementia while balancing symptoms management and quality of life?
Okay, so given the prevalence of polypharmacy, we mentioned before, polypharmacy is the use of consumption of 5 or more medications by one person. And the best practices for identifying potentially inappropriate. So what's a potentially inappropriate medication? There's a list of medications out there called the Beers criteria. Those medications are deemed potentially inappropriate. They're potentially inappropriate because they could potentially cause harm to our older adults if used by themselves, if used in combination with other medications. So it's a lot of different factors involved in that list of potentially inappropriate medications. But some of the reasons why some drugs may appear on the Beers list or the potentially inappropriate medications list is that maybe it increases the potential for sleepiness or drowsiness or dizziness. And all of those things can lead to what? A fall in our older adults. We want to prevent that at all costs. Falls can be very, very detrimental to our older adults. And falls related, medication related falls can be prevented. And so those are reasons that drugs may appear on the potentially inappropriate medication list. Other things that other factors that can cause a drug to appear on the potentially inappropriate, I mentioned before, dizziness, lightheadedness, all of those things can impact one's activity of daily living. It can impact how I think we talked about caring for grandchildren. It can impact the run of the day for anyone. So the question, I appreciate the question, but it's a lot of different factors involved, and it's not just one answer to that. I think I heard something about deprescribing. Deprescribing, that would become more of a clinician. I'm not sure if there was a clinician that asked that question, but that would be a question that would come with be a discussion between the caregiver, the patient, the pharmacist, and perhaps the healthcare provider in seeing what medications can we deprescribe. A lot of times people, as young people, get put on medications that the condition or the situation resolved itself, and then but that medication continues to be refilled, or it stays on the disease state list, and it just next thing you know, you're 75 and you're still on something that's no longer relevant. So that's a discussion and a review with the pharmacist, the healthcare provider, and the patient and caregiver to determine which one of those medications we can start to take off, which ones are impacting the activities of daily living of our older adult at this stage where they are today. Yes, thank you.
Thank you, Dr. Tyler. Great answer. Yeah, so I can see where it can be a little bit complex when it comes to situations like that. So thank you for that. And I think we have time for one more question. I'm going to grab one from here. So I'm going to refer to Ms. Akinimifimo. How do you work with older adults who perhaps are not ready to make changes or who struggle with adherence to care plans?
So if I understand the question right, what you are saying is, how do you work with caregivers that don't comply with their care plan?
Correct.
Okay.
How do you work with older adults who perhaps are not ready to make changes, who struggle? Correct.
Okay. That's the majority of the people. Most people, they don't want to be compliant, but we just have to keep encouraging them, talking to them and letting them know that this is the best plan for them. And at the same time, you can just keep introducing one change at a time. With dementia client, they can learn a lot at the same time. So you introduce a little change every time. So, and then you have to be consistent with it. So with you being consistent, then that's how they learn it. That's how they agree to make that change, with time. So I'll give you an example. There was a client that we took care of a while ago, more than 10 years ago or so, and we took care of her for like 3 years. When she first came to us, she didn't like to shower. Okay. And she didn't like to shower because where she came from, obviously, they did not introduce that into her care plan. Probably they asked her to shower and she refused and they let it go. But how can you take care of somebody when you can get close to them and hug them, when they have, they are not smelling good to you? So what we started doing is 3 times a week, we put in the care plan for her to shower. At first, she was so hostile to us about it. She would scream and yell, but we kept doing it every week. Every week, Monday, Wednesday, Friday, we were doing it. And if she needed more, we gave it to her. I noticed that after about 2 months, even when it was not a shower day, she get up in the morning, use the restroom, and she will ask us, "Do you want me in there?" She's asking if we want her in the shower. Okay, so that's the power of being consistent with it. So most of us, we've been used to our independent life. You don't want nobody tell you what to do, but when you need it, you need it. So I believe in the power of, being very patient with them and explaining to them and being consistent. This will give you the result that you need at the end of the day. Thank you.
Thank you for that question or for that response. Yes, I see Dr. Tyler, you have your hand up. I think we have a few more minutes. So
Real quick, I just want to
yes,
clarify something. The Beers list is a list of medications that are potentially inappropriate. That does not mean that you will not see older adults on those medications. That just means that we may have to adjust the dose, we may have to adjust the timing, but that doesn't mean that the patient is not going to be prescribed any of those medications because benefits often outweigh the risk. So, but I mentioned when I first started talking is that we need to be also educated on the side effects and things of that so that we are aware of some of the potential things that may happen if one is on those medications. I just want to clarify that.
thank you so much for that. And again, thank you everyone for your comments and questions and answers and your responses. So any questions that were not answered during our live session, they will be answered in our upcoming newsletter. So thank you. I'm going to go ahead and move forward with our presentation. So just friendly reminders, online attendees, make sure you please post your questions in the Q&A box. Survey links have been posted. It's a free 1-hour community health CEU hours. So please complete the survey and the evaluation to receive credit. And you can scan the QR code for the links. Again, we're streaming live on Facebook and YouTube. And so we invite you to share and to stay connected with social media. Following us on social media and subscribe to our mailing list. And all right, so here is our calendar of events. So we have webinars all the way scheduled through May 2027. As you can see here, each month is a different health topic. We do have some in-person conferences as well and education events as well. So to get more information, please, you can scan the QR code. It will direct you straight to our link tree to provide you all our upcoming events and with any additional information. So thank you. One of our upcoming events, which is pretty much right around the corner, is our back to school outreach events. We have one upcoming, and the first one is on July 25th of 2026. It'll be held from 8 to 12. This is actually going to be held in Powerhouse Church. Address is here. Again, this is information that can be found in our link tree. And then our other back to school outreach event is scheduled August the 8th. This is from 10 a.m. to 1 p.m. And this is going to be at the DIC Spring Church with the address. Again, we'll be providing, immunizations. Back to school, we'll be able to provide resources to the community. So again, feel free to click on the link tree and you'll get some additional information on that. And again, like to just friendly reminder regarding our check, monitor, control study that is led by Dr. Poon and Dr. Tyler. If you're interested, the QR code is here so you can sign. Again, this is for African American individuals. The target population, the target number is 480 for adults that are older than 55 with hypertension. So again, if you're interested, please scan the QR code and please share with your partners and the community. And another reminder regarding our clinical research program, it was launched back in May 2025. We have been able to recruit over 375 interested participants, and then again have fully consented to 200 individuals. Again, QR code is here. If you're interested in joining, scan the QR code. Everything is found also in our link tree. Please share again with partners and within the community. And we'd like to also mention our TSU Mobile Health Unit. This health unit is pretty much up. It's up and running or ready to go. This type of mobile health unit is able to provide preventative health care services directly to the community, which is led by Dr. Ajawoli Muimwa. We're able to provide, there's dedicated spaces for mammograms, preventative care services, and also health education and community engagement activities. So if you're interested for partnering, for funding opportunities, please reach out to us. We are looking for partners through sponsorships and maybe future collaborations out there in the community. So please reach out to us if you're interested. So thank you. And just another friendly reminder, online attendees, make sure to complete the surveys. And again, if your questions were not answered today, they will be answered in our next upcoming newsletter. You will be receiving a 1 hour CEU. And again, we stay active and connected on social media. So please scan the QR code. We have Facebook, Instagram, Twitter, LinkedIn, and YouTube. And you could also text at TSUCEC. And again, I just want to thank everybody for joining today and for the great responses and questions that were addressed today. And we hope to continue to see you in the future events. So thank you so much.
Hello again. My name is Veronica Ajawale. I want to say a big thank you to each and every one of you for joining us for today's program. I am very certain that you have received a lot of great information that you will put to practice as we all grow together to become a healthier community. Thank you to our speaker and our panelists. Thank you for sharing today's content with us. Thank you to our locations. Thank you to our interns, our volunteers, to our sponsors and our funders. Thank you also to the staff of our program, the faculty, and the leadership of Texas Southern University for supporting us in making today's program a success. Most importantly, I want to say thank you to each and every of you, the community members. We appreciate your support. We do not want today's program to end just with today's event. We want you to continue to collaborate with us and engage with us. Our social media platforms are located at CECTX Southern U. On those platforms, you will find engaging information from today's program and all the other programs that we have going on in the Community Engagement Corps. So we implore you to continue to stay connected with us, engage with us as we move forward together in building a healthy and a wealthy community. Thank you for joining us, and we look forward to connecting soon. Bye.